Let me say mostly from grade 10 to grade 12. I didn't watch television. Even now, I don't watch television. Everybody will know.
Jesus is Lord. Oh, is that what we're doing wrong? Is that
Yeah,
what?
yeah.
Tina, as we are sitting there watching Muvango, distinction people are not watching. Okay, okay. We are learning. We are learning. Ma'am, thank you so much and thank you for making time. Can you please just take time to introduce yourself? Tell us about who you are, where you come from, and why you chose the career path that you chose. Over to you and thank you.
Thank you so much, Teoho. I'm Vusanani Muthala, now known as Dr. Vusanani. I'm from Mabode. It's a small village in Mutare, around Thoyando. And I chose this career path because one day my mom just woke up and she said she wanted me, she dreamt of me being a doctor.
Wow. And
Yes,
and where were you by then? Were you doing grade 12 or what?
I was doing grade 12
Yeah.
because before that, she told me that around June when I was in grade 12 in 2016. Before that, I always wanted to be a meteorologist.
Okay.
So I did apply at the and also UFS. But at UFS, it was for agrometeorology. It
Mm,
had
mm.
meteorology. Yes.
Okay.
Yeah. I did get accepted, but then when my mom told me about, she dreamt me of being a doctor. Then that's when, okay, let me apply also to study medicine. Then I checked all the universities that offers medicine, and only University of Limpopo was the one that was still open. All other universities were closed.
Mm.
And I still remember very well. It was on the 13th of June, 2016. They were closing
Wow.
of June. It was
Wow.
just for them to close. Then I went to Toyozo. I printed out the form. I did everything by myself, and I
Wow.
sent what's this post office, the first mail one. That's how I
Mm.
listened.
Wow. 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 Very interesting. And so, were you guys the first cohort of the University of Limpopo medical students? Because I remember they started with medicine late. Were you the first cohort?
No, so the first cohort started in 2016.
Okay.
The second cohort.
Okay. 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 I get you. I get you. Wow. Wow. Interesting. But I like that the fact that you started by searching institute that offer medicine, and I think that's where most of the learners they fail to do, basically to check all the institute that offer the course that they want to study, because I usually recommend that you should apply to all institute, especially if they're open. It's unfortunate on your side that they were closed, but at least you had one that was still open, maybe because it was still new at that time. Hence, it was still open to try to get more students. But then it means you must have done very well. It makes you to apply late and still be accepted.
It wasn't late.
Or
It,
you're still within the time frame. Okay, okay, I get you. Okay, but then you must still have performed very well at that time because you did not even apply with your the year before with your grade 11 marks.
yes, I applied using my grade 11 marks. And also with some universities, I used my March results. Yes.
Okay, okay. And were you accepted at the first time?
Ah, no.
Is it? What happened?
So they responded around September just
Mm,
to give to the application.
mm,
And around maybe November, I think, I'm not sure. that's when they were like putting you in the course that you're going to study. So they said we regret that accepted for Bachelor of Medicine and Surgery, but you are accepted for your second choice.
What was the second choice?
My second choice was nursing.
Okay. Wow.
So I was really hurt, hey?
Shame, I can imagine.
Okay, but my grade 11 results were not that like perfect. I was like, I'm going to work hard. I still have time. I still have time to work harder and get accepted. Hello. So I think my grade 12 results, if I compare with all my high school results, my grade 12 results were the ones that were very, very good. So after that, I got my matric results. I had 5 distinctions.
Wow. Wow. Wow.
English and geography. Yeah, I got 79 on English and 75.
Wow.
Yeah, those are the only
The other 3 distinctions were on what?
The other 5 distinctions I got, it was maths, physical
Jesus.
sciences, life orientation, and Chivenda. Yes.
Wow. You were Limpopian high achiever, mas. Wow.
So I think I was getting 3, 4 distinctions somewhere there, but maths and science was always included in life sciences.
Were you always a distinction person, student all the time?
Yes, I would get some of the distinctions, mostly life sciences and physical sciences. Maths, it started in grade 12 most, but throughout my high school, I used to be like number 2 position.
Wow.
Yeah.
I wish I got number 1 and 2 at high school. I wish.
When I was grade 8.
You started when we were at grade 8.
Yes,
Wow.
that time I got position number 1. But all this while I would get like position 2, 3, yeah, around
Wow.
there.
Wow. Now tell me, maybe somebody might be watching in grade 11 or grade 12, and they also want to get position 1 and 2. What do people with position 1 and 2 do that us with position 100 don't do? What do you guys do? Is there something special that you guys do that we don't do? How was your studying? How were your studying pattern, routines, and whatever that maybe you think, in your view, led to you achieving such a high marks?
Okay, I would say from primary, I used to be like a very good student. Even in primary, all my teachers knew me that I am a very good performer and everything. So it didn't start in high school. It all from when I was still very young, because I was not even supposed to be completed my medicine this year. Should have been completing next year because I got promoted even back.
Wow. No, we'll get to that. That's very interesting. So,
Yes.
but tell me then, when you got to your high school, were you, and I'm going to make an example. I will come back from school. I will put my books there, go play soccer, come back, I'm tired, bath, eat and sleep. How was your life different from us who lived like that?
Let me say mostly from grade 10 to grade 12. I didn't watch television. Even now, I don't watch television. Everybody will know.
Jesus is Lord. Oh, is that what we're doing wrong? Is that
Yeah.
what?
Yeah.
Tina, as we are sitting there watching Muvango, distinction people are not watching. Okay. We are learning.
If Muvango, I know, and up until grade 9.
Jesus.
I stopped doing. When I was in grade 10, I stopped watching television. So even when it's break time, or if there's a period that is free, because you wouldn't get taught in every period. So all those periods that were free in school, I would use them for studying. Mostly, like, I can't study theory in front of people. So I would do maths and physical science because it's more of calculations every time, whether it's break time or their free periods or the studies, because there was something that we used to call studies after the school knocks off. Would have me, you have to sit and you're studying. That was in high school.
No, we're learning. Yeah, and I think what you're saying is very important, that you use every opportunity that you have in order to study. And obviously, it doesn't come cheap. It comes with some form of sacrifice. Like on your side, you sacrifice Muvhango. And as we watch Muvhango, we got the marks that also correlate to watching Muvhango. And I totally agree with that, because I remember when I got to varsity, I used to love soccer so much. And I had to sacrifice it, because I can just imagine. And when I got to varsity, they introduced me to English Premier League. Now you have got a game on Tuesday, game on Wednesday, game on Friday, game on Saturday, game on Sunday. I saw that if I continue like this, I will definitely fail. And what you are saying now reminds me of that I started to watch soccer when I completed. And you are right. I think what is needed is the sacrifice. And it will start with television. I think television, they say, is the biggest enemy to progress. No, I'm happy with that. So let's get back to you getting into nursing. You say you were very sad, and I want to understand that you had nursing as your second choice. So why were you sad when you have been accepted to your second choice?
Because when a parent tells you they've got a dream that you are a doctor, and like achieve those dreams, you feel like it's something I wanted initially. But then I was like, I would want to make my parents happy more. So when I was not getting the opportunity, it really made me sad. Made me sad.
So what was the thinking behind medicine? Why did you have it as your second choice, if it makes you so sad? the nursing. Why was it a second choice?
Okay, so I thought maybe if I don't get to medicine, at least to work at the hospital. Maybe that's what she wanted.
Okay. So okay. No, I've got a question, but let me reserve it. So you accepted the nursing offer?
No, that time they were just letting you know what you got accepted for, so that next year with the matric results, they will still like reconsider if you're because that's the final say.
Okay.
Now it's just a
conditional acceptance and a temporary arrangement. Now, if maybe your marks are better, we might reconsider you. So were you on the waiting list for medicine?
They didn't say that I'm on the wait. They just say accepted me for BCA, which is nursing, and I should come register next year.
Okay. And then what happened the following year?
So the following year, I got my results the first week of January. So when I got my results, I saw that my results are really good, and they really, really shocked me. I don't want to. So at that time, the very same day I got my results, the very same day I took my statement from my high school, I went to University of Venda because I had applied for nursing also there. The nearest university, Venda. There is no way you can apply at university. Statement there because I had that they are accepting statements the very same day. So parents, I took my statements there, and also I had applied to the Limpopo College of Nursing. A lot of people. Okay, I don't know if we should talk about it, but I also applied it. It's one of those nursing where you get a stipend of 7,000 plus.
Yes, I remember even us at Medunsa back in the days, nursing student used to get a stipend. I think now they've stopped it, but they used to have it in the past.
Yes. Colleges of nursing, you get a stipend, you don't pay any fees of basically. So I also applied there. They also took my statements to the Chiridzini Hospital, I think. That's where they were taking them. Yes. So after that, the following day, we went to University of Limpopo to submit my statement. This thing of not checking online, are they accepting statements and everything? We found out taking statements at that time. They're taking Monday, because I think the results came out on Thursday. And when the University of Limpopo was starting to take statements on the following Monday.
Okay.
So we got returned back. It was just of trouble.
I can imagine. I can imagine.
I didn't even know where University of Limpopo was. I very far. I didn't know, because I used to think it's Medunsa. I didn't even have like information about it.
Yeah, I can imagine. Shame.
So on that Monday, that's when because I had already seen the place and everything, then I went using a taxi alone. I went to University of Limpopo and I submitted my statement, and they told us within few days we'll get
Feedback.
Get the feedback. So I submitted to nursing and also for medicine. That's for both nursing and medicine.
Okay. And what happened after 3 days?
So after that waiting period, a lot was happening. I'm getting other acceptance from UFS, from UJ, from wherever. And
for the engineering part?
Yeah?
For the engineering that you were rejected for?
From UFS.
UFS, you applied for what? Was it not engineering?
It was for agrometeorology.
Yes. Okay, yes.
For nursing, I think I also applied for TUT for nursing also, because they don't have me. Yeah. So, and remember, I was very late, so I couldn't even apply to all these other universities. I couldn't. So, still waiting for University of Limpopo's response. I'm not getting it. So while I'm waiting, I decided, okay, whichever university that's going to accept me, that is very near, because I didn't want to go far. So out, I was like, I'm not going to Bloemfontein. I don't even know anyone in Bloemfontein.
I can imagine. Yes.
So University of Venda, I heard that they pasted, they didn't send any SMSs or anything. They just put a poster with your names to say you've been accepted at the university.
How?
So
University of Venda, how do they do that? Imagine if you're in another province, the only way to find out. Okay.
So yeah, my name was on the top of the list when I got there, and then I went and registered. I was like, I'm registering in the meantime while waiting for University of Limpopo's response.
University of Venda, you applied for what?
For
nursing, okay.
So yeah. I even got, there was this bursary that they were giving at that time. It was sort of like a merit bursary from, there was a lot of sponsors, I think also part of it. Yeah, they were giving, I think, 50,000 for everything that you go. Yeah, they were only giving 3 students. I was one of the students that I got that bursary.
Wow.
So I did register. I was done. I even got a room same day.
Wow.
And there was also an interview that we did before we registered. Yes, interview, and then they called us for coming to register, and I did that. Then the very same day, I just starting, everything is sorted, finances are sorted. I miss a call because I'm busy going up and down at
I can imagine. I can imagine.
University of Limpopo. And they called someone else that I also put the number, which was my aunt. So they call my aunt, they say, I got accepted for medicine.
Wow.
Wow.
Wow, 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 wow. You must have been excited to hear that.
Very, very excited. So she told me that they said I should call back because they want to talk to me personally. I didn't even have airtime at that point. I still remember, like, what's this? I didn't even have a bank app at that time.
Yeah, I can imagine. I can imagine. You are a doctor. It doesn't matter. Sure, shame.
So I had to buy that paper airtime because the taxi rank and then put the airtime, call back that number. Told me I should come tomorrow. Been calling you and everything. Please come tomorrow. I'm like,
wow, 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 wow.
And I slept somewhere in Sishio. Then in the following morning, I went to University of Limpopo.
Wow, 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 wow. No, good to hear, man. Very interesting story. But I think what I'm also taking home here, and for anybody watching this, is that it's always good to have an alternative option. Even if it might not be the thing, that might also make you angry when you get accepted for it. Just have it for backup.
Yes.
Because the reason actually I didn't want to ask you that question before, I wanted to hear how you got into medicine, because nursing can also be a way into it. People can do first year and then apply for medicine. So it's always good to have a second option for whatever the reason. I've seen people who say, you know what, me, I'm a high achiever. They will take you. You never know what might happen. You never know. You rather be accepted for a second choice than be without an institute at all. And you are stuck at home and they're seeing a genius walking on the street of Toyando. They're wondering, the high achiever of the whole school doesn't get accepted. So I think it's a lesson from your story that just apply, because had anything happened, you're not accepted for medicine, nursing has taken you, has given you bursaries, your life was still going to be better and nicer studying medicine because you were covered financially. So I think it's a very, very good story. So you got to medicine, and how was it? First year, being at the university, at least not so close from home. How was it?
So I get there. We were even staying in like non-sharing room. I was very
wow, 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 wow. At first year.
Yes, I
Wow.
know.
Wow, 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 wow. University of Limpopo. Wow, wow, wow. Impressive. So does University of Limpopo have a separate medical campus from the other institute? Or are you all at the same institute?
It's the same institution. They don't have a medical school as yet.
Okay, okay. No, wow. It means they've got a lot of races to have singers at first year level.
Yeah, so if you're studying medicine at the University of Limpopo, there is no way you're not going to get accommodation. There's just a rest that is for medicine students. You would
Wow.
if you want accommodation, whether you have failed, whether you repeated, it doesn't matter.
Wow, wow. And I think that's what I tell people, that, sometimes consider the historically disadvantage of Black Institute, particularly if you don't want to stress about the residents. Because I like what you said. Sometimes you go too far, institute that are too far, you find you get there, you are stranded. While you could have lived a better life at home. Imagine a rest at first year. I mean, people will stress to have a rest and stay alone at first year level. No, that's impressive. I'm glad to hear that. So you got there, you're staying alone, and how was it?
So when I got to University of Limpopo, I don't have a bursary. I don't have NSFAS.
Mm.
So every money that I was getting was from parents, like,
Yeah.
and
You are remembering nursing now.
I'm really going to stress about anything,
Sure.
I don't have a book allowance. I don't have, everything I have to buy for myself.
Sure. I can imagine. I can
Food,
imagine.
they have to be paid. Everything, accommodation, it has to be paid. So,
Mm.
but first year, I got a merit bursary. They were giving out merit bursaries if you got an average of more than 75% or 80%. I don't remember very well. Yes. So I got a merit bursary to pay for registration, accommodation, and tuition fees.
Wow. Wow.
So
You
that
are
was,
still not watching Movango by then.
I'm not.
I can imagine. Wow. No, that's great.
So then everything was paid at that time. Everything was going well. And then I still remember around July, then our vice chancellor got us a small bursary for food, only food allowance. I think it was from Nedbank. Yeah, so we that's the first time I just got the luxury. When you are in university, you just want to have that card.
I
You,
know, definitely. Definitely. I
you
know that.
like, yeah. So
It's
that's
tough.
a visit card, and
Yeah.
now I'm everywhere.
I can imagine.
So for my first year from July, yeah, it was nicer just because I got that visit card, and yeah, I really did well. Even academics, I was doing well. And another thing that I would like other people to know, and if you're studying medicine, is that in your first year you do of physical sciences, chemistry, and biology, which is life.
Mm.
And then you also have other modules that you are now being introduced to medicine. So, but there is some bit of difference because in high school we used to do 2 dimension in physical science. Then now it's like 3 dimension. There are formulas that we used to do in high school, and now in university they kind of change a bit.
Mm. Mm. Mm.
Challenging, but uh, for for me, I was really doing very, very well. I even got exempted for all those subjects.
Wow. Wow. Wow.
So,
So tell me, for somebody watching in matric and is still considering whether engineering or medicine, are you able maybe to give a correlation to say when you get to medicine, the bulk of medicine, and I'm talking about from first year to final year, which subject in particular that you are doing that you can correlate to with the subject in matric? What would you say is the bulk of your work? Are you doing physics from first year to final year and chemistry, or just give somebody an idea who's watching, who has never been in a medical school, is still considering the option?
okay. I would say life sciences is the one that correlates the most with medicine because life sciences, although it has other parts about plants and the environment, but it also has parts of the body. So those body kind of like make an introduction for you to know what is going on. Because even in first year there was this module called introduction to structure and function, so it was basically just learning all their names, of which you did that in. So it was like they're just a superficial anatomy, like, yeah, in high school. It's just that it's added a bit. Yes. So I would say life sciences kind of correlates more with medicine, but then it's 0.
Just a small drop in the ocean.
0.1% of
Yeah.
it. Yeah.
So the physics, the chemistry that you do in first year, do you carry them to second year or they end at first year?
They end at first year, and the physical science is completely different from the high school one. It's just that if you knew how to do the physical science in high school, you will be able to understand very well now in varsity.
What about mathematics?
There is no mathematics at all.
In medicine, even though they want mathematics.
Yeah, there is no mathematics.
You see, now somebody's scared of medicine because of mathematics.
You have sciences, physical sciences, and mathematics as your main subjects if you want to be in medicine. So I did get all those distinctions, because usually, even if you get, it's not even about distinctions in medicine. If you get distinction in Chivenda, geography, and life orientation, you get 3 distinctions, right? But the distinctions that they want is life sciences, mathematics, and physical sciences, and also English sometimes. So all these 3 are the most important ones. Even if you just get 3, you can still.
No, I'm glad to hear that you mentioned that. And what subject do you do it at second year level? If you can recall, just the one that you can remember. I know it's a long time ago.
I think I still remember all of them. So we do it's systems of the body. There's 11 systems, I think. So we do respiratory system, cardiovascular system. We also did a gastrointestinal system and the genitourinary. And the last one was clinical medicine. Yes, the modules that we did. It was just the systems.
And at the third year level?
And third year, we are completing those systems. In second year, we also did endocrine system. So third year, we did reticuloendothelial system, musculoskeletal system. We also did central nervous system. We also did reproductive system. And I think that was it. And then clinical medicine.
So basically,
clinical medicine.
It goes back to what I was saying, that life science is actually the most dominating part. For somebody who wants to do what they do in medicine, it's dominated by mainly life science. And is that part of your anatomy? Do you guys have cadavers there at University of Limpopo?
Yes, there are cadavers available. So I think we used to have maybe 10 cadavers, and then they would group us into small groups in those cadavers. Then when we do those systems, if now we are doing reproductive respiratory system that we started with, we had the chest, you are seeing everything, you have to bring your dissector.
Okay, before we get to that, I think just give us a bit of a background, because there are some people who get into medicine, when they get to the cadaver stage, they want to leave medicine. So give us a background. When you speak about cadavers, what do you speak about and what does it entail? And then go and explain that part as well.
Okay.
For somebody who wants to do medicine, just give them an idea of that there's this aspect about it.
Okay, so for those who don't know what cadavers are, it's simply a dead body that was put a lot of chemicals so that it doesn't smell and it doesn't
decompose.
Turn and decompose. So that's what a cadaver is. When you touch the body, it will still feel like it's fresh. Every time you are there, it won't smell anything except for the formalin that they usually put every time. So that's the so if you are not comfortable in seeing dead bodies, then I don't think medicine is for you, because for the first 2 years, for second year and third year, that's going to be your life. You first thing, you go to the lecture room, you get taught. After that, in the afternoon at 1 every day, dissection hall. Dissection hall, and you come back at 4. So that's my life every day. In
so 1 o'clock to 4 o'clock, you are with a dead body every day. Okay, so basically, and I wanted to take it just to explain further, because when we spoke about the different system, the part that I wanted you to also get into is that you use these dead bodies to learn about those particular systems, to see them. Just explain that practical aspect. What do you do when you get there?
So what we do is that we have a kit. It's called a dissection kit. It has scalpels, scissors, artery, forceps, everything that you need to dissect. So, but it didn't have blades. They used to give us blades because we need to change blades every day. So they would give us blades to cut. So we also used gloves. They used to provide gloves for us. But that time we didn't even use masks. We got used to the smell. So yeah. Now I think now we are used to masks, because that time when you wear a mask, I couldn't even breathe. But in a way that I would be, if now we're dissecting, I would wear a mask every time. The mask in a way that I couldn't even breathe. But
I get you.
So we wouldn't wear mask at all because we wouldn't know how to breathe.
No, I get you.
So that's the kit you use. You bring it every day. You have to clean it every day. And then there's also this book that is called Grant's Dissector. That's what you need. It has every instruction that you need to dissect step by step. So people who were teaching us how to dissect, they would wait for us for that specific thing that they really want us to know in the body. Like maybe there's something interesting that they really want us to know, then they will come when they know that we are there. But otherwise, we were just reading the book and dissect. Someone would be reading, we are dissecting, teaching ourselves, and then they would move around, tell us. If you have questions, you ask them. So it was basically more of yourself, not the lecturer or anything. That's medicine for you. You have to put in more work.
And familiarity with the anatomy of a human being, so that you don't just speak about a kidney which you have never seen, and you don't know which part of the body it is. No, thank you for that, because I think and this is the most continue.
Section, those modules were 9 weeks. So in medicine, another thing about medicine that people don't know is that even my parents still don't understand this, but I keep on telling them. So in medicine, you don't do modules and right at the end of June, end of December. No. You do a module. That's why I said there are different modules. So if carry system right now, we were doing it for 9 weeks.
You study in blocks?
Yes, we do blocks. So for 9 weeks, we are done. You are done with that module. You never see it again. You are done. Pass it, you are done.
So does it mean it's easy to pass medicine?
I don't write exam card June. There's no exam time.
So does it mean it's easy to pass medicine because you are focused on one thing, you write the exam about it, so it's not easy to fail?
No, it's the idea behind it, why they did it, is because I don't think you'd pass medicine if you had to do all those things.
Because it's a lot of work.
A lot of work. It's a lot of work everywhere in South Africa, except in Medunta. I think second year, they only do anatomy and physiology the whole year, of which is big because you're only doing one thing the whole year. Rest of the years and the rest of the universities we do blocks. It's a week. So it could be possible for one to do everything and you write at the end of the year.
I can imagine. It's a lot of work. Yeah. And when do you go to the hospital? And what do you do?
So you start going to the hospital in 4th year. 4th year, that's when you start your clinicals.
And what do you do when you get to the hospital?
So with the hospitals, there are modules that you do in 4th year. that you rotate amongst. So we were doing obs and gynae, psychiatry, pediatrics, internal medicine, and what else? Surgery, general surgery. I think those are the ones, if I still remember quite well. So those modules, we were doing them for 6 weeks. This time around, it's you need to know obs and gynae in 6 weeks.
So break it down for somebody who doesn't know what obs and gynae is. What do you do in obs and gynae? What is it?
So obs and gynae is a short of obstetrics and gynecology. So it's more of maternity, it's more of pregnancy and giving birth. And the gynecology part is more of any condition that a woman can have in their genital system, like in the vagina to the cervix to the uterus, this reproductive system. So
what do you do when you get to the hospital? I'm asking you this because I know you have got a distinction in it.
I knew what we used to do. We'll attend a morning meeting, and then after the morning meeting, you go to the wards. So we do ward rounds. Ward rounds is basically just seeing patients one by one, moving from one patient to another patient. And you do those ward rounds with the consultant. Consultant is a specialist of obstetrics and gynecology. And you have registrars. Registrars is people who are starting to become a specialist. And then MOs, medical practitioners, it's just someone who has already completed their community service and internship, and now they have no specialty that they are in, but they have an interest maybe in that specialty that they are now at. And then they are community service practitioners, which it's after 2 years of internship. Then they are interns, which they're just from medical school. That's for they do it for 2 years. And then they are students. Students, they would have the final years, and us in 4th year, that time when I was in 4th year. So that's how much you'd be. You'd be like maybe 12 people seeing the patient. Yeah. Divide us into groups because there are a lot of specialists, so they divide into specialists, those students divide us. And is that in a class, the moment you reach 4th year, where you do your clinicals, let's say we are 60. Now I don't have 60 classmates. I now have 10 classmates. Those are the people that I'm going to rotate to with up until I'm done with my medicine degree.
Wow, no. So continue. Sorry.
After the ward rounds, there is a lot of percussion. Percussion is just a taping body to examine a patient. So as in medicine, we call it percussion when a specialist is asking a question and you don't know the question and he keeps on asking. And he's bringing all the questions to everybody. It's quiet. Looking at you and thinking, I'm going to be touched by this one who doesn't know anything. Clinical, it gets really bad in a way that sometimes consultants can even make you feel like you don't belong here, or patients judge you because you were being percussed the other day. All this, it happens. So after that, after the ward rounds, then we do ward work. So ward work is basically going back to the patient when the specialist is gone. You go back to the patient, you do everything that the specialist says must be done. So if it's taking bloods, if it's putting up a drip, anything that needs to be done for that patient that day. So that's
and where's the nurse at that time? What's the nurse's role?
The nurse's role, mostly they're supposed to come. One nurse is supposed to come and do ward rounds with us, but they're usually busy and don't join the ward rounds. But then they assist us sometimes if maybe you're struggling putting up a drip, because you can struggle as a doctor to put up a drip. It's not like every time you're gonna get it. They can come and assist you. They assist also in giving patients medications, feeding patients, you know, everything around the patient. Yeah, so with doctors, they will come and do every procedure that needs to be done on a patient, and the nurse will come and take care of it after that. If you put up a drip, they'll come and change it if it's finished. Yes, so that's the role of a nurse.
Okay. No, sounds very interesting. Sounds very interesting. I'm sure anybody wants to do medicine, at least now, they have an idea of what it entails. And are there any long hours involved in the process? At what point will you say you start to work more like a doctor? Or are you a student throughout until the 6th year where you only work from morning to 4? Is there a time when it goes beyond that?
From clinicals in 4th year, you start working like a doctor. You will start feeling like a doctor because it depends on which block is it that you're doing. Because some blocks, the consultants are more involved. They want students to be more involved. So, like, for example, when I did internal medicine in 4th year, I felt like I was the doctor. I felt I had every say in a patient. The consultant would say, if there are 20 patients, and I was rotating with only another student who were 2. So those 20 patients we have to divide. So 10 patients for me, 10 patients for him. Those patients, you come in the morning. Early in the morning, you must come, check the patient, examine the patient, and write the notes. All those notes that they write when we're doing the ward rounds are written by me. So I would write all those notes. When we do ward rounds now, nobody's writing, we're just adding on. It's just an add-on. I need to sign, I need to do everything. So when it comes, he will just add on to maybe what I left or what he wants to do that I didn't know. Was you really felt like you are the doctor, because every time you are the one going to see the patient knows you, or okay, this is my doctor. They even call you doctor from when you are still in
Wow. Wow.
I have to say, no, I'm a student, to avoid unnecessary.
No, I can imagine. But anyway, I'm sure you're enjoying it so much. I'm sure you're enjoying it so much, and your family was very proud that at least the dream of your mom has been fulfilled.
I think in medicine, the enjoyment, it can be really throughout, because with the modules they differ. Everybody has whatever they like. So in medicine, you won't find the one thing that you really like. Yeah, broad. There are different things. So there's some modules that I'm not interested in. Then I wouldn't really enjoy. But there are modules that you are really interested in, like obstetrics and gynecology. I love obs and gynae. Every time I feel like I belong there. So yeah, those are the modules that you would like. Even when you have to do something, you do it with more passion, and you are not waiting to go back.
Does it mean you are considering specializing in it in the future?
Yeah, obs and gynae and dermatology, between the two, I will choose as time goes.
Is it? Okay, great. And tell me, so for somebody who doesn't know, how long does it take to study medicine?
So it takes 6 years at the University of Limpopo and other universities, except University of
Free State. Yeah.
University of Free State is 5 years.
Okay. And so when you finish the 6 years, what happened afterwards?
So when
Which is where you are today.
Yes.
Wow.
The 6 years. Final year, there's a lot of things going on. You have to apply for your job where you want to be. So basically, I think we applied around September, somewhere there. Yes, so you choose 5 hospitals that you want to be, and then they will choose for you the final one that you're going to, amongst those 5 hospitals. So After that, when you complete your degree, you are an intern. You are an intern. So you do internship for 2 years. And then the internship, it's not like other internship in other fields, wherein even as an intern, you get a very little amount of salary. This is just called an internship because
you are working under supervision.
You're working under supervision. You're not really qualified per se to work. You can't do.
You can't work independently.
Can work independent. That's what it basically means, because you're just from school. You don't really know everything. You still need to. So yes, that's basically what internship is. And after that, you become a community server. You do community service for 1 year. Community service is basically just going back to a rural hospital and you serve your community. That's it. And then after that, you are now a qualified doctor.
When you are under community service, are you still being supervised, or you are now independent?
It's just that you are placed where there is not a lot of things that
resources,
because you are in the rural where there's not more of maybe complicated surgeries that you can do, because in rurals you only do cesarean section. That's basically what they do. So everything you do in the rurals is something that you can do without supervision, but you are supervision.
So in short, one can say the formality of medicine is basically the 6 years, because when you get to internship, in a way, you are actually a fully fledged doctor. And then obviously community is more like exposure, community service and all that, to expose you to different contexts. And where are you going? Which hospital have you decided on, or where have you been selected?
That's one of the questions I'm not going to share.
Okay, let me leave that one out. And so you are starting on next week.
Yes.
I won't say you are starting next week. And how do you feel now, having gone through the process? Your mom's dream has been complete, has been fulfilled, and you are now about to start your internship. You've got 3 distinctions. And how does it feel at this point, being where you are today?
Right now, I really feel nervous. From starting from week started, I'm so nervous. I don't want to lie.
Is it?
Yes.
Why are you nervous?
I don't know. I really don't know. I'm so nervous. But before, when December started, when I got my results, I was so excited. I couldn't even wait. I was just like, can this December end already?
I saw with the photo, which is what connected us, that I mean, you were so ecstatic.
I was
look, I think it's you know, that fear of the unknown. Every time you get into a new thing, you know, it's just the fear of the unknown. I think it's normal and it will settle in. But it's that no, we're not going to a new environment. But I think not much will change beside the environment. Obviously, you get new people to deal with. That will be more the difference. And tell me, you got a distinction in 3 modules: psychiatry, open gyne, and anesthesiology. I've been struggling with this name for the rest of my life. I avoid it where I can. So tell me about them. Why distinction on these 3? Are these your best? You like them the most, more than everything?
Okay, I would say obstetrics and gynecology, psychiatry. It was a repeated distinction, because we did obs and gynae and psychiatry in 4th year. So I was consistent. I got distinctions in those 2. And actually, my 4th year, my highest mark was obs and gynae. I got an 83.
Wow.
So final year, still, I always knew that I'm going to get a distinction in obs and gynae and psychiatry, because when I started psychiatry, it was even the first time actually being exposed to psychiatry. I didn't even know what much of it and everything. Yeah. So when I did it, I started realizing, okay, I really love this and I'm understanding. Yeah. I think when you really see that, yes, here I'm understanding everything and I might get a distinction. Work more harder and get it. So yes, those two I got a distinction in fourth year. And then anesthesia, we did anesthesia also in fourth year. I think yes, we did it around March when COVID started. I did it for 1 week. We got taught, I think, for a few days, and then we went to the hospital to see the anesthetic machine and be taught about it. So I got the exposure for only 1 week. And COVID started, we were sent back home, and I was missing this anesthesiology that I still need to do. And when we came back, I think we had to catch up anesthesia. I think the time we came back, because we came back around July. At that time, for 4 weeks, we were catching up with anesthesia. Then we ended up writing it the following year.
Sure.
It was really hectic. You can imagine if you're doing something, you started doing it in March, you stop March for 1 week, you do it in July for only, I think, 4 or 2 weeks. You stop, then you write exam in the following year in January. So you can
Sure. I can imagine. Wow. Sure. No.
It's something that you need, because the whole module setup was that we are going to go to theater and see everything. That's why they even took us to the hospital just to see the old anesthetic machine that they used to teach with. And then after that, when we know now the anesthetic machine, we're going to go to theater and see the real machine that is working, and that is there. Learn all the anesthesia. It's more of, if you don't see something, you will never know it. Like simple, maybe an oropharyngeal airway. If you don't know it, how are you need to. So it's more of, there's a lot of pictures. Even when they asked us, they used to bring a lot of pictures, because it's more of, you have to see something. See something and know everything, that how to label something about it. That's more of anesthesia in fourth year. They wanted more of us to know the instruments that they use. So I think I got a 69 anesthesia, because honestly, it was very, very difficult. I don't want to lie. We even used to fear it. How are we even going? So when I went, anesthesia was one of the stress that I had. From January up until I did it, I want to do anesthesia and get over it. I want to, when you want to do something and just be done with it. It's so difficult. It's one of the subjects that they are most feared. So when I did it now in final year, it was for only 3 weeks. But the way I told myself that, okay, let me put this challenge for myself. Everybody is always saying anesthesia is difficult. Let me put this challenge on myself and see if it will also be difficult for me. Let me not take other people's experience and put it in my head. Then I went in and started. I used to be so active. I don't want to lie. I worked so hard for that distinction. I used to be very active. I still remember even doctors operating, seeing me doing everything, intubating the patient, maintaining the patient who is being operated. And they would say, "Are you an intern?" I'm like, "No, I'm a student." They're like, "You are lying."
Wow. Well, it means you're really invested in the process. No, to get a distinction, really, you must have worked very hard. I was impressed when I saw that picture
But
that you put and the distinction you got.
my first mark when we wrote a like a mid-block test during that period of anesthesia in final year, and I think I got an 87, and I was like, yeah, the work that I'm putting in is really showing, you know. It's
Wow.
so I should continue.
Wow, thank you so much, Dr. Vusanani, newly qualified medical doctor. Internship, we said fresh from the box. Thank you so much. I really appreciate it. In conclusion, I've got two questions. One is for any medical student who might be watching this and they are in the midst of their blogs and they are wondering what they got themselves into, why they don't have life, and they wonder if is it worth it. What word of encouragement can we give them so that we can strengthen them as they continue in their journey of being medical practitioners?
I would say that the reason they went into this degree, the reason they got accepted from the first place, it really means a lot, because we know in South Africa a lot of people want to be doctors, and it's so hard to just be accepted because there is a lot of competition. So for them to get accepted, they must take it as a grace of God, and God wanted them to be there. So they must just take it like that, to say, I've started this and I'm going to finish this. Because once you finish, everything is just really, really good. The moment I got my results, when I finished, that's when I started even sleeping. I sleep a lot, I don't want to lie. Ever since when I got my results, from when I got my results, I sleep a lot.
Wow, wow, wow.
I'm telling you.
Wow.
Because I used to not sleep like this.
Mm.
Couldn't even sleep more than 6 hours. I didn't
Mm.
have, just to have that 6 hours of sleep. It's very rare as a medical. You have to be studying, and when you come, everything is on you. You have to clean. You have to cook. You have to study. Everything is on you. You have to do all to manage your time. Say that just continue pushing wherever you are, even if you are failing or in everything. Just know that there was something that they like God wanted you there, and He will let you finish. Don't give up. Keep on pushing. Keep on working hard. It will happen.
Thank you so much, Doc. I really appreciate it. And lastly, any grade 11, grade 12 student watching this, they will love to become doctors one day. When we put this video, probably it will be early Jan. People are still hoping to get into medicine. Others are starting medicine. What word of encouragement can you also give to those students who are doctors to be?
Okay, for the grade 11 and grade 12s, I would say, okay, from grade 10, I would say if you want to be a doctor, you have to go for the stream of physical sciences, the mainstream of physical sciences, which includes physical sciences, life sciences, and maths, pure maths. You need to do all those so that you'll be able to be accepted. Because if you do any other subjects, you won't get into medicine. That's where it starts. And grade 11, I know that everybody knows that grade 11 is really, really difficult. It's the most difficult grade in high school. So don't get discouraged. Just work hard. Even if you don't get the marks that you really wanted, apply for what you want. And also apply for other things that you feel like your marks can also get you into. But if you know that you're going to really work more harder in grade 12, then don't be scared to apply with those marks, because at the end of the day, like I said before, even with my experience, my marks were not that really, really good in a way that I would say I was gonna get accepted. But when I got my final results, my matric results, they were fit to for someone to study medicine. So don't be discouraged because of your grade 11 results, because grade 11, it can be very difficult, but grade 12 is very easy. It's very, very easy. I don't want to lie to you. Grade 11, that's where there is difficulty, but grade 12 is very easy. Just focus, ask your teachers, get the study guides that the teachers are recommending to you. And if you don't understand anything, just go ask. Let everything of the world pass you. There will be time that you will get everything that you want, friends, going out, doing whatever. Just stop it for now and focus on your grade 12 so that you can get good results, because anywhere you go, grade 12 results are always going to be needed. Even now when I have to get my job, they are still saying bring your matric results. Everywhere you go, they will always ask for your matric results. So make sure that for that specific year, you dedicate that year for your academics. Yeah.
Thank you so much. I think those are really encouraging words and words of wisdom. Let the world pass you by, but knowing that later you'll be able to enjoy yourself and you can have what you want. Dr. Vusanani, thank you so much. I really appreciate your time. It's good to speak to a student and a medical graduate. Thank you so much. I appreciate your time and have a wonderful day.
Thank you so much for having me. Thank you. You need to do all those so that you'll be able to be accepted, because if you do any other subjects, you won't get into medicine. That's where it starts. And grade 11, I know that everybody knows that grade 11 is really, really difficult. It's the most difficult grade in high school. So don't get discouraged. Just work hard. Even if you don't get the marks that you really wanted, apply for what you want, and also apply for other things that you feel like your marks can also get you into. But if you know that you're going to really work more harder in grade 12, then don't be scared to apply with those marks, because at the end of the day, like I said before, even with my experience, my marks were not that really, really good in a way that I would say I was gonna get accepted. But when I got my final results, my matric results, they were fit to for someone to study medicine. So don't be discouraged because of your grade 11 results, because grade 11, it can be very difficult, but grade 12 is very easy. It's very, very easy. I don't want to lie to you. Grade 11, that's where there is difficulty, but grade 12 is very easy. Just focus, ask your teachers, get the study guides that the teachers are recommending to you. And if you don't understand anything, just go ask. Let everything of the world pass you. There will be time that you will get everything that you want, friends, going out, doing whatever. Just stop it for now and focus on your grade 12 so that you can get good results, because anywhere you go, grade 12 results are always going to be needed. Even now when I have to get my job, they are still saying bring your matric results. Everywhere you go, they will always ask for your matric results. So make sure that for that specific year, you dedicate that year for your academics. Yeah.
Thank you so much. I think those are really encouraging words and words of wisdom. Let the world pass you by, but knowing that later you'll be able to enjoy yourself and you can have what you want. Dr. Vusanani, thank you so much. I really appreciate your time. It's good to speak to a student and a medical graduate. Thank you so much. I appreciate your time and have a wonderful day.
Thank you so much for having me. Thank you.